Hello everyone, welcome back to our channel, The Upcoming Doctors. So in this video we are going to start the pharmacology, that's a mbbs second year. We are starting with on your demand. We are actually starting the autonomic nervous system, which is also called autonomic pharmacology. So let's get started. So this is the introductory video actually. So I'll give a glimpse of autonomic nervous system. We have the introduction part, and also we have the cholinergic system, and again the cholinergic agents, which is nothing but the cholinomimetics and also the parasympathomimetics, right? And we have the anticholinergic agents, skeletal muscle relaxants, adrenergic agonist, which is nothing but the sympathetomimetic agents, and also the adrenergic receptor blockers. In the adrenergic receptor blockers, we have the alpha type and also beta type, so called alpha blockers and the beta blockers. So this is the topics of autonomic pharmacology. So we will be discussing in this order. Now this is the video. The present video is about the introduction. So we have the nervous system. So nervous system, we have mainly the central nervous system and the peripheral nervous system. In the central nervous system, we have two parts mainly, the brain and the spinal cord. Coming to this peripheral nervous system, we have two main systems again, the autonomic nervous system, which is our topic of concern. Another thing is the somatic nervous system. Actual meaning of the autonomic nervous system is nothing but the involuntary. Whatever the actions are not under our control, for example breathing, we can control the rate of breathing, okay, and also the heart rate, force of contraction of heart. All these things are actually going inside our body without knowing. That's involuntary, no, right? So autonomic nervous system is nothing but involuntary. Whatever the involuntary is the autonomic nervous system. Whereas the somatic nervous system, so we can control actions. So these are the somatic nervous system, whereas the sympathetic nervous system and the parasympathetic. So autonomic nervous system is again divided into two systems, so called sympathetic nervous system and the parasympathetic nervous system. So this sympathetic nervous system is also called as thoracolumbar outflow, whereas the parasympathetic nervous system also called as craniosacral outflow. So now how to remember this? So this parasympathetic nervous system, like this sympathetic nervous system is like big word compared to the sympathetic nervous system. So cranium, we have these things, no, so called cranium, and then after that cranium, otherwise cervical, okay, after that thoracic, thoracic ke baad lumbar and then sacral. So from this cranium to sacrum we have the big thing. So this is called the parasympathetic is also big word, so remember parasympathetic is also called craniosacral outflow. Otherwise this sympathetic nervous system also called as thoracolumbar outflow. Now we have to discuss this sympathetic nervous system. The ganglion, here I wrote ganglio, this is the ganglion actually, okay, right? This ganglion, we have the ganglion is nothing but the group of first of all I'll explain this neuron is present, no? So I'm drawing roughly. This is the neuron. We have so called dendrites and also cell body. This is up to here, wait, okay, like yeah, up to here we have the cell body. This entire part is the cell body. This is the axon of the neuron. So like this, the group of cell bodies is called as group of cell bodies of the neuron is called as the ganglion. So it is a relay station. Then whatever the ganglion, the neuron is present in front of the ganglion is called preganglionic, and whatever the nerve is present, no, after the ganglion is called postganglion. So this preganglion and the postganglion are actually present. So first of all the action potential is traveling through this preganglion, and it relay station is our ganglion. After that what will happen, the action potential is again regenerated and it is transmitted to the postganglion, and then it will be innervated to the organ of interest, whatever the organ, okay, the sweat glands or otherwise the breast, otherwise the kidney, whatever the organ, interest organ. So here this is the sympathetic nervous system. Coming to the parasympathetic nervous system, we have the cranial sacral outflow. So we have two outflows again in it, cranial and sacral. So cranial equals to 3rd cranial nerve, 7th cranial nerve and 9th and 10th cranial nerve. Sacral is the S2, S3 and the S4 spinal roots. So we have the parasympathetic, so called preganglionic and postganglionic again. So this parasympathetic nervous system consists of the preganglionic is long, okay, whereas the postganglionic is short. This is exactly vice versa of the sympathetic nervous system. So how to remember again this? So this parasympathetic nervous system has to P, here we have P, and again preganglionic P and the postganglionic P. So remember this piece. So parasympathetic nervous system having the long, so this word is again long, the parasympathetic word is long compared with the sympathetic word. So the parasympathetic is coinciding with long preganglionic and short postganglionic. So this you have to remember, right? So see, This is the preganglionic, which is very long in case of parasympathetic, and the preganglionic is short in case of sympathetic, right? So now we have to discuss about the one question. So we have many visceral organs inside our body. So like spleen is present, stomach is present. So these are all the visceral organs. Lungs, some have the dual nerve supply. And then how, what do I mean by having the dual nerve supply means, actually the dual nerve supply consists of both the sympathetic nervous system and the parasympathetic nervous system. But how it will be controlled by only one system means, the nerve supply is from both the sympathetic nervous system and the parasympathetic nervous system. But ultimately we have only one predominant system, either it may be the parasympathetic nervous system, otherwise the sympathetic nervous system. So we have the only one nerve supply predominantly, so that will be acting on the organ. So now we have two mnemonics, which is nothing but only parasympathetic nerve supply and only sympathetic nervous supply. So we have parasympathetic supply by CPG. The mnemonic is CPG. Like you have remember CPG exam is there, no? So remember like CPG is nothing but ciliary muscle, pancreatic glands and the gastric glands. So these are supplied by only parasympathetic nervous system. Whereas sympathetic, so here we have again ciliary muscle, pancreatic and PG. So P is there, no? So that's for parasympathetic. Here S word is there, no? That's why you have to remember sweat glands and the spleen. And hair follicles, how to remember means, like sweat glands are present, like you have to assume the location of the sweat glands. We have beside the sweat glands only we have the hair follicles. That's why we have the sympathetic supply starting with S letter. We have the sweat glands and spleen, both are starting with again S letter. That's the mnemonic. And we have the beside the sweat gland we have the hair follicles. We can remember that also. And another one to remember is most of the blood vessels. So most of the blood vessels will be having the sympathetic nerve supply. So this is all about the introductory part of autonomic nervous system. So we have the CNS, PNS we have autonomic nervous system, somatic nervous system. Our interest is about the autonomic nervous system, mainly of the sympathetic nerve supply, parasympathetic nerve supply, which is called craniosacral outflow, parasympathetic nervous system, and thoracolumbar is a sympathetic one. You have to remember, this is very important. The preganglionic is short in the sympathetic and preganglionic is long in parasympathetic. I have given a mnemonic, you remember that, and the two mnemonics we have to remember. So with this background we are going to start the proper autonomic pharmacology videos. So this is all about our video. Thank you for sharing. So you have to subscribe to the channel for the upcoming videos, and you can go to the comment section and type whatever topic you want, whether it may be first year, second year, third year, MBBS. Thank you.